What does iron deficiency lead to in the body? Iron deficiency can lead to a number of health problems in the body due to the critical role that iron plays in many bodily functions. Here are a few examples. Anemia. The most common consequence of iron deficiency is iron deficiency anemia, which occurs when there is not enough iron in the body to produce hemoglobin, the protein in red blood cells that carries oxygen to the body's tissues. Symptoms of anemia can include fatigue, weakness, shortness of breath, pale skin, and rapid heartbeat. Impaired immune function. Iron is important for the proper functioning of the immune system, and iron deficiency can lead to an impaired immune response, making the body more susceptible to infections. Cognitive function. Iron is also important for brain function, and iron deficiency has been linked to impaired cognitive function and developmental delays in children. Restless leg syndrome. Iron deficiency has been linked to restless leg syndrome, a condition characterized by an uncomfortable urge to move the legs, particularly at night. Hair loss. Iron is also important for healthy hair growth, and iron deficiency can lead to hair loss or thinning. It's important to note that iron deficiency can have serious consequences, especially if left untreated. If you suspect you may be iron deficient, it's important to talk to your healthcare provider about getting tested and treated. Symptoms of iron deficiency. Iron deficiency can cause a variety of symptoms, ranging from mild to severe. Here are some common symptoms of iron deficiency. Fatigue and weakness. Feeling tired and weak, even after getting enough rest, is a common symptom of iron deficiency. Shortness of breath. Iron is necessary for the production of hemoglobin, which carries oxygen to your body's tissues. If you don't have enough iron, you may experience shortness of breath or difficulty breathing, especially during physical activity. Pale skin. When you're iron deficient, your body produces fewer red blood cells, which can cause your skin to appear pale or even yellowish. Headaches. Some people with iron deficiency may experience frequent headaches, including migraines. Cold hands and feet. If you have an iron deficiency, your body may redirect blood flow to your vital organs, leaving your hands and feet feeling cold. Restless leg syndrome. Iron deficiency has been linked to restless leg syndrome, which causes an uncomfortable urge to move your legs, especially at night. Brittle nails and hair loss. Iron is essential for healthy hair and nails, so a deficiency can cause brittle nails and hair loss. It's important to note that some people with iron deficiency may not experience any symptoms, especially in the early stages. If you suspect that you may be iron deficient, it's important to talk to your healthcare provider about getting tested and treated. Causes of iron deficiency in the body. Iron deficiency can be caused by a variety of factors. Here are some of the most common causes. Inadequate dietary intake. One of the most common causes of iron deficiency is not getting enough iron in your diet. Iron-rich foods include red meat, poultry, seafood, beans, lentils, tofu, spinach, and fortified cereals. Blood loss. Blood loss, either from injury, heavy menstrual periods, or internal bleeding, can cause iron deficiency. Chronic bleeding from ulcers, hemorrhoids, or cancer can also lead to iron deficiency. Malabsorption. Some medical conditions, such as celiac disease, inflammatory bowel disease, or surgery to remove part of the stomach or small intestine, can make it harder for the body to absorb iron from food. Increased demand. Pregnant women, infants, and young children have increased iron needs, and may develop iron deficiency if they don't get enough iron from their diet. Medications. Certain medications, such as antacids or proton pump inhibitors, can interfere with iron absorption and increase the risk of iron deficiency. Genetic factors. Some people may have a genetic predisposition to iron deficiency or conditions like thalassemia or sickle cell anemia that affect iron metabolism. It's important to talk to your healthcare provider if you suspect that you may have iron deficiency, as they can help determine the cause and recommend appropriate treatment. Treating the causes of iron deficiency in the body. Treating the underlying cause of iron deficiency is the most effective way to restore iron levels in the body. Here are some common treatments for the causes of iron deficiency. Iron supplements. If you have an iron deficiency caused by inadequate dietary intake or increased demand, such as during pregnancy, your healthcare provider may recommend iron supplements to help boost your iron levels. Iron supplements are available in different forms, including tablets, capsules, and liquids. Treating underlying medical conditions. If your iron deficiency is caused by a medical condition, such as celiac disease or inflammatory bowel disease, your healthcare provider will focus on treating the underlying condition in addition to supplementing with iron. Managing blood loss. If your iron deficiency is caused by blood loss, managing the underlying condition that is causing the bleeding is important. This may involve treating an ulcer, hemorrhoids, or other medical conditions that cause bleeding. Adjusting medications. If your iron deficiency is caused by medications that interfere with iron absorption, your healthcare provider may recommend adjusting your medication regimen or switching to a different medication. Dietary changes. Making dietary changes to include more iron-rich foods is another way to address iron deficiency caused by inadequate dietary intake. Good dietary sources of iron include red meat, poultry, seafood, beans, lentils, tofu, spinach, and fortified cereals. It's important to work closely with your healthcare provider to determine the underlying cause of your iron deficiency and develop an appropriate treatment plan. In some cases, iron supplements may not be recommended, or may even be harmful, so it's important to get professional guidance. Thank you for watching. I invite you to subscribe to the channel and activate notifications until you receive all new